My memoir teacher asked me to write 3-word sentences and encapsulate our story. This is our daughter, Madison. Walked on Westcliff, saw a house. We moved in. 7 months pregnant. Maddie is born. 10-pounder, 23 inches. We are home. We are happy. Baby has gas. We call doctor. Bring in baby. They find tumor. Ground falls away. Trip to Stanford. Big pediatric department. Oncology, radiology, diagnosis. We stop breathing. Conversation with doctor. Lips are moving. Don't hear words. We take breath. Smiling, hugging, crying. It is okay. Maddie is strong. She gets Hickman. We get training. Nurses ask questions. Maddie's 2 moms. This is family. Home at last. Doing own nursing. Blood draws, antibiotics. Change the dressing. Raise your child. Outside a lot. Look at birds. Go to beach. Back at hospital. We are scared. The next chemo. Hair falls out. She is sick. Crying a lot. Medicate with food. Antidepressants, please. Clinicians who care. Summer jerks. Maddie's still sick. Nancy prepares meds. No visiting nurse. It's all us. This really sucks. We are afraid. Maddie is growing. She's so funny. Ask doctor help. She sends nurse. She leaves crying. Just too hard. No more nurse. What the hell? Holidays in hospital. Sleep in alcoves. People bring gifts. Time is precious. Back at home. Special nurse comes. Offers home chemo. Same with blood. We are elated. I shave head. Maddie likes it. We are bald. One last chemo. Huge celebration. Pull the Hickman. We drive home. Message on machine. Cancer is back. Floor falls out. Our hearts crack. Maddie is sweet. She looks fine. We call panel. They recommend radiation. We do radiation. Everyday drive. 6 weeks total. Cancer comes back. Go to beach. Build a castle. Live every minute. Maddie's breathing changes. It is time. 4 days total. Singing, crying, laughing, candles, sage, prayer. Takes last breath. Lives are shattered. World continues spinning.
This is Theo, born so strong, full of love, seemed totally healthy. 4 days old. Something seemed wrong. Called the doctor. No, he's fine. Trusted my gut. Took him in. Lines, meds, tubes. Rushed to Stanford. Half a heart. Crashed at home. Needs 3 surgeries. Repairs are palliative. 16 days old. Then 7 months. I pump milk. 8 tube feeds every single day. I'm pregnant again. This one's healthy. But Theo's not. Now it's cancer. 2 years old. Football-sized liver. Take it out. It has spread. Stage 4 now. Scans of lungs. They tell us he won't live. Still, we try. Baby is born. We start chemo. 6 long months. Fevers and neutropenia. Then it's gone. We live life. Every single day. Appreciate each moment. 4 years old. No more tube. Theo is eating. He is happy. He is growing. 3rd heart surgery. He does well. He is smart. Swimming, biking, baseball. Loves his brother. lives each moment. Monthly blood draws, 6-month checks. Will need transplant as a teen. But for now, he is happy. 9 years old. An amazing child.
And with that, it's a great honor that I introduce to you Tara Manjunath and Lisa Buell. It's obvious from looking around at the faces that you guys care very deeply about the work that you're doing with kids. And one of the questions that I have here is, can you guys give some examples of times when you've been working with clinicians, whether it be in the hospital or within the home, and you really felt like they cared?
Okay. My resounding example of a time when a clinician has really shown empathy and compassion would be our cardiologist at Stanford, Dr. Bernstein. He was away when Theo was diagnosed with cancer. And the morning, he actually had a liver resection surgery before we started chemo. In the morning of his surgery, he was really sick already. I mean, when he was diagnosed, he didn't seem super sick to us. He just had low-grade fever, kind of, was the tip. But by the time they actually were able to schedule the surgery, he had become extremely ill. And we were waiting to go into the OR, and Dr. Bernstein had just gotten back into town. And he came and found us and just got down on his, I was holding Theo and I was pregnant, and he got down just on my level, eye to eye, and really talked to me and just said, "I'm so sorry." You know, you could really see that he couldn't believe it just as much as we couldn't believe it. And just that he was able to show that he cared in that way really made a big difference. A lot of times I think clinicians put up a boundary to showing that they care. And just knowing that it doesn't take much, but that really made a big difference to us, and that he visited us always on the floor, even on the oncology ward, which wasn't necessarily convenient for him. You know, just really going the extra, not even mile, like extra centimeter really makes a difference to the family.
I think you care every time you walk in the room, honestly. But one example was when I think we were about 5 months in, and it was such a struggle to give your daughter poison, you know, and hope that it's going to work out. So we were doing a lot of the Western medicine coupled with some Eastern medicine, and we had talked with our doctor about it and all of that. And I think I was just, you know, Madison was losing more and more weight, and I was just so volatile. It could have gone either way every day. I just felt like I wanted to save her, like just take her and run, you know? And so it was just a lot. It was a lot on our relationship. And my partner Nancy and I were in the room, and our oncology doc came in, and she walked in and said, you know, "How are you doing?" And I was like, wow, that's a loaded question, you know? How are we doing? I'm like, we're doing okay. We're handling it, and we're on top of it, and doing a lot of the care at home. And she said, well, I didn't want to talk about Madison. She said, I wanted to talk about you guys. She said, this is where parents start to lose it. I was like, oh, funny you should mention that. You know, Nancy's just sitting there like, yeah, she's been losing it. And so she said, this is a really critical time in parents' lives. And she said, we're about halfway in, and this is where you really need to be on the same page and have a lot of communication and get your breaks when you can take them. And as a parent, especially with two moms, I mean, we're both like trying to do everything possible. We had that whole nurturing thing happening, and we weren't on the list. We hadn't put ourselves on the list, and it's really hard to do that when you're, you know, fighting for your child's life. And it was really nice, because then Nancy was like, babe, do you want to go for a walk up on the rooftop, or do you want to, you know, and I'm like, oh, do you want to, you know, or I'd get something extra from her, you know, for her from the cafeteria, just those little tiny things that then it was like, oh yeah, we're a family. It's not just about Madison. And so that was really helpful. And the doctor really stepped out of her, I think, scope as far as, you know, what you learn, what your scope of practice should be or whatever. And she didn't refer us to the psychologist or the chaplain or whatever. She really had a lot of courage and stepped in and met our family right where we needed to be met. So I think that's an example of really caring.
How were the two of you first told about your child's diagnosis? And telling you about the diagnosis, is there things in terms of that conversation that you took away that were really positive that you would like to share? Or maybe are there some things that you would like to share that perhaps steps that they might want to avoid when talking with the parent about the diagnosis?
Let's see. Well, the first diagnosis of hypoplastic left heart, we were transported from Santa Cruz to Stanford. And the whole thing started in the morning, and by 10 p.m., the same cardiologist I mentioned before pulled us aside in the parent little pumping room of the NICU and told us what was going on. But that, up until then, we just knew something was drastically wrong. We didn't know what. And so he did a great job. He drew, we knew nothing about hearts. We're not scientists or doctors or nurses. And he drew pictures of a normal heart and how it works, and of Theo's heart and how it works, and drew pictures of what the surgeries would do if we chose them, and just really communicated very clearly, took time for our questions. It was 10 o'clock on a Friday night. He's the chief of cardiology there. He's a busy man, and he would have stayed there for 2 hours if we needed him to, just answering questions. So that was really an effective example. Oncology was not as smooth. They were just really shocked that they were dealing with this really rare cancer in a child with hypoplastic left heart. That kind of was a double whammy for them, like it was for us. They kind of didn't know what to do with us because it had never been seen there before. So they did the best they could, I think, initially. Once it spread, however, we didn't know initially that it had also metastasized to his lungs. So that's when they were giving us no choices. We had already done the liver surgery. We were waiting to start chemo. And I was there. By this time, Tommy, I don't know if I was still pregnant or if Tommy was just a brand new baby, but either way, the oncologist came in. I was there. Tommy was born. He was a newborn. And I was there alone with them, and my husband was at work, and Theo was getting amphotericin. He had a yeast infection systemically, so we were going every day to Stanford. And the doctor came in and just said, I just saw his scans, and there's a spot on the lung, so there's nothing we can do. He's definitely going to die. We don't know when he's going to die. It could be tomorrow or in 5 days or in 5 years, but he definitely can't survive this. And then left the room. So I'm left there with this baby and this other baby, and I'm trying to just be happy and strong and have to still drive home over the hill by myself. And it was just horrible. I had no support system with me at that moment. And they said it in just such a cold way, like he was just a patient and not a person that was there listening to this as well. And it was just really not the most effective way. So I think just really seeing what support system, planning. If you have horrible news to deliver it at a time when, the family is kind of supported and maybe more able to take this kind of news.
Madison, when they first discovered her tumor, she had just had gas, is what we thought. So we had called the pediatrician, and she said, oh, it's probably just gas. Let's do Gas-X over the, she gave us the prescription over the phone and just said, just pick up some Gas-X. And so, but she continued to kind of bear down, which apparently she was trying to pass the tumor. And so we'd taken her in, and thank goodness we had a Chinese doctor that wasn't trained in the States. He wasn't a pediatrician. We just went to walk-in. And because apparently, this was 12 years ago. And so apparently during that time, they would never have done a rectal on one of the first passes when you first see a baby. And he actually did and felt the tumor. And so we had to spend one night at home, and because we were waiting for a bed. which I couldn't even imagine. You know, I mean, it's just like, what do you do? You know, we were just petrified, and so we had to stay at home one night. And within that night, my brother, who's a firefighter and paramedic EMT, ended up moving in with us, and he actually never moved back out for Madison's whole life. So we had the support there. We drove over the hill, and I just remembered thinking, because we didn't know that it was cancer at this point. We knew it was a tumor, lots of speculation about what kind of tumor it could be, and we ended up on the oncology floor. And all these wonderful nurses were coming up and introducing themselves, and I'm like, la 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 la, you know, this is not my life. I'm not going to listen to you. I'm not going to remember your name. You know, I was in complete denial, and they were showing us around and showing us where different things were, and what's that with all the towels and the linen supply closet, you know, and all this, and I'm thinking, I don't need to know where that is. We're not going to be here for long, you know. And the nice thing was that I had called one of our friends, and she met us up there, and we didn't want to have Madison hear, even though she was only 5.5 months old, any of the news, right? So we had her out of the room. So my partner Nancy and I in the room, and we just took extensive notes and then asked lots of questions. And so that was really a clinical, we just kind of stepped into a whole other, I wasn't going to be I really wanted the clinician to look at me and look me in the eyes, and because then I felt like we were in this together, you know. So I just thought, if she can just look at me, and she did throughout, which was great. And so we went from there. But and we made it a policy just to have a friend with us all the time when we were in the hospital, and to receive or talk with clinicians so we could be fully present there. And they gave us a journal so we could have it with us all the time for those questions that come up in the middle of the night and you can't get back to sleep. You just roll over and write your question, which was really helpful. When Madison was re-diagnosed, when she actually the cancer had come back, and so this was after almost a full year of chemotherapy and surgeries. And we knew initially that we had one shot at it. And the type of cancer that it was, it turned out that once they were able to do another surgery and get a little bit more of the tumor, it turned out that it was a different type of cancer completely than we had been treating for a year. And the different type of cancer that it was usually grows through chemotherapy, grows through all of the things, and the child is dead within a few months. So we had a whole year with Maddie. But we got the first call, like I said, we pulled the Hickman because they didn't see any visible signs of cancer, and the doctor really wanted us to wait. And we were like, you know what, we're going to Disneyland, we're going to, all these things you guys have said, you said there's no other options, so we're pulling the Hickman and we're gonna go live. By the time we got back over the hill, we actually got a message on our machine saying that it wasn't like, call us, we need to talk with you. It was, the cancer, actually there is a spot. We noticed with the radiologist that, double check the scans. So that was a little strange. And then we decided to do the radiation, and then the doctor again, after we did this, the scans, called us. So it was another phone call. And that was a hard one. And at the time, so this is 12 years ago, almost 13 years ago now, and he was talking about palliative care chemo. For one, I didn't know what palliative care was at all. For two, after I got off the phone, I thought it was a type of chemotherapy, because he said that we have palliative care chemo. It doesn't cure the child, but it can help with, it could extend the life a little bit. It could help her feel more comfortable. And I was like, well, if it's not a cure, we are gonna live with our daughter and give her the best amount of her time possible. And apparently that's not what typical, that parents do, but for us it felt like the right choice. So, so kind of double. Part of it was really good, part of it was really hard, and you know what? It's a really hard and complicated situation with all children that have serious illnesses, and you're not always gonna get it right, and with each family they're gonna have differences of how they receive information, what works best for them. So, but on the phone, probably not the best way. So.
Can you give examples of when you actually felt like you were part of your child's medical team? We talk a lot about bringing parents as parent advocates and being having parents be part of the team. Can you give examples of times when you felt that you were a part of that team?
Well, other than when Theo was in the NICU, when we did leave at like 11 o'clock at night and go home and sleep till 7:30, come back after morning rounds. After that initial NICU 6 weeks, once he was hospitalized ever again, we always stayed with him around the clock. For one, once you've had your child at home and you really know them, it's much harder to leave them than it is when they're an infant, newborn, and you're sleep deprived, exhausted. But it's, one of us was always there around the clock. There were times when I had to actually stop nurses from giving fluids at 500 cc's an hour instead of 50 cc's. Because I was like, this is going to overload his heart. And they were like, no, this is the orders. And no, actually, it's not. And I can tell you to stop because I know it's going to kill him if you don't. So, you really do have to be vigilant and proactive and be present, which is, I can't imagine how it must be for some parents who can't be there because they have a lot of other children at home or because they don't have the knowledge and the power in themselves that they can say that to a doctor or a nurse. So that's an example. Also, just whenever he was in the PICU, I was kind of the annoying parent who would insist on being there when the doctors would round so I could hear what they were saying and ask questions. Try to catch them. They could try to sneak in during that little 7 to 7:30 change of shift time. And I would just, try to be there when they were there because I wanted as much information as I could get. And I was realistic. I knew that sometimes he didn't have a great chance, but I wanted to know and educate myself and research. And I did a lot of that. And really just knowledge is key. Some people don't want to know a lot. I was a parent who did and does want to know as much as I can about everything he's going through so that I can make the best informed choices, and that's definitely being part of the team.
Our first experience with feeling like we were part of the team happened within, I think, about 3 days that we were in the hospital, and we had just had a slew of our friends that had come up, and everybody's in and out, and then all the doctors and nurses that are in and out. And even though it was a private room, it didn't feel terribly private. And and I'm a nursing mom. My daughter's 5.5 months old. She's prolific nurser, and I've got plenty of milk, and she's not eating. So inside, my hormones are racing, and I was really having a hard time with. For one, Madison's tumor, you couldn't palpate it. Apparently it was the size of a grapefruit. I always love how everybody uses fruits to, anyways, size of a grapefruit, but you couldn't palpate it. And she was only this big, so I thought, well, that's a small grapefruit, but couldn't palpate it, and yet everybody was trying to. And every time they took her diaper off or would, say, or tried to get under it, I felt like they were violating her. Felt like a violation. And I felt like I was witnessing this and letting this happen, even though she was on my lap. And I'm trying to talk her through it. I'm still feeling like, oh my God, this is so awful. And so I was trying to talk with my partner, Nancy, who's much nicer than me. We do have the good cop, bad cop, or good witch, bad witch thing, and I'm always the bad witch. And so she was like, well, honey, and she comes from a long line of teachers, and she's like, this is, we're going to a teaching hospital. This is part of it, and I'm like, it doesn't feel right to me. I don't want it to happen anymore. And I'm like, they can't palpate it. I want them to just stop. And so we were having this discussion, and I'm getting more and more wound up. And I'm in the hospital room, and by this time I'm having to pump and express my milk. So I'm sitting there with like 2 pumps, feeling like a cow. Mm-hmm. And Nancy's holding Maddie, and I'm looking over at her, and she's got all these tubes, and what's happened to my baby. And so I'm getting more and more emotional, and this nurse comes in, and she goes to hang the fluid, and so she says, as I'm getting more upset about it, she said, well, she's your baby, and just kept on hanging the fluid, and then she walked out. And initially I was pissed. I was thinking, this is a private conversation. Why is she butting in, And then I realized what she said, and it really sunk in. And I thought, yeah, this is my baby, and I get to decide. And in that moment, it was so empowering because I talked with Nancy, and it felt like we got a win-win, because I said, you know what? I think we should have the doctor and one intern, because there was like 12, something like that, coming in, and everyone wanted to touch her and do things to her. And I said, one doctor, one intern. And it was awesome, because it felt good that Nancy felt a part of it too, and the decision. So we didn't have that part going. And then the next time the rounds came in, the people came in to make rounds, and everybody's hovering over, and you know this. And I said, you know, we're going to go ahead and let a doctor and one intern. And they stood up and stepped back. And I was like, yeah, you know, that was a good decision. And that's when I realized we're a part of this team, and we don't have to. I mean, we're so scared to death, and as parents, we just want you to fix our babies. We just want you to fix our children. We want this to all go away, you know. But by doing that, we're also giving up a lot of our own power, and then we're having to deal with our own internal stuff around it. So the more that you can make us a part of your team, the better, from the beginning.
Along that same lines, are there times, or were there times when you felt pressure to be the good patient, the good family?
Well, what comes to mind initially to me is that when Theo the first time ever he was transported from Dominican to Packard, he was 4 days old. It was when we still didn't know what was going on with his heart. And I was, you know, a new mom. I had all this milk that was just starting to come in. I didn't know what was going on. And basically went from holding him and having him at home to having him within 5 minutes, like intubated, umbilical lines, head shaved, IV in the head. I was just like, what the heck is going on? You know, where's my baby? And, you know, sedated him, tied him down. Just, it was horrible. And I just was pretty hysterical, obviously. And they didn't let me go in the ambulance with him. And they gave me a Polaroid picture of him, because they didn't think he would make it, which I didn't know at the time, but later realized that's what the picture was for. And I was just thinking, why are you giving me this hideous picture of my kid like this, you know? And it just was so horrible, disgusting looking. And I wasn't allowed to go with him, so we had to drive in a separate car over the hill while he was transported, and then, you know, sit in the little aisle of the NICU waiting for them to wheel him by in the little plastic incubator. You know, no, there he is. And so the next time when he was diagnosed with, or on the road to being diagnosed with cancer, at Dominican they had done a CT and found that he had a tumor. They didn't know yet if it was cancer or not. And I was 7 months pregnant. And I just stayed super calm, kind of almost fakely, like inside was hysterical, but I didn't demonstrate that because I wanted to ride in that ambulance. Like, I could not imagine at this point turning him over to an ambulance and not going with him. Again, it's very different with a newborn or a child you've had at home for 2 years. And they let me ride in the ambulance with him. And yeah, that was just really empowering, and a time to really learn that sometimes being the good patient, even if it involves a little acting, can be beneficial. You're not taken as a hysterical mom outwardly. Sometimes you get a little bit more respect and privileges, I would say.
Mm-hmm. Mm-hmm. We actually got a lot of respect and privileges, and we like that a lot. Mm-hmm. And we are very good and respectful parents and patients, and in fact, I'm thinking they had the rule of just one parent in the room, because of the beds is what it was supposed to be, the bed. And I remember I'm 6'1", and I remember shoving myself in that crib, that steel crib, because then there was one bed open, and I was like, yeah, we're within the rules, and so I'm sleeping with Maddie in the crib. But there was one time when we did most of our care through the Children's Hospital, which was about an hour away. Our local hospital wasn't able to care for Maddie because they weren't equipped, for one. They didn't have the training, for two. And we were petrified every time we went there. And our insurance made us go there. And said, we will not pay if you have an admission that isn't pre-authorized. We will not pay for you to go to the Children's Hospital. So several times we had to go to our local hospital, and so, you know, we knew the drill on the Hickman, but the nurses there didn't. They weren't trained on it. And so we'd ask, are you comfortable with Hickman care? And they were like, you know, not. And so if they hesitated at all, we did it ourselves. And we asked by the third time, because it was getting old and we were getting really tired by doing our own child's care, if we could just be transferred up to the adult oncology ward, because that's where they knew Hickman's. And they're, no, you know, because they don't do pediatrics up there, they're adults. And I'm like, okay, and it could make the adults sad, and the nurses sad because they're not used to working. And I was like, okay, you know. And so this was, you know, that was a 5-night stay, and we were up around the clock doing IV, you know, antibiotics with our child and all of that. And also then getting lots of, so obviously I was the mom because I was nursing, right? But Nancy was also the other mom. And they didn't feel comfortable referring to her as the other parent or mom or any of that. So they kept on saying your friend, which was a little aggravating to say the least. And so I would say, oh, you mean Maddie's other mom, or Nancy, or, you know, and I'm trying to do, and it was just really awkward and awful. So I actually sent a strong letter after that and said that I'd be willing to help with diversity training or, you know, anything they needed around that. But middle of the night, Maddie has a fever, we race over to our local hospital, and of course there's no standing orders, and we're having to wait for antibiotics, and it's starting to get escalated, and usually I would keep myself in check. I mean, I was the bad witch, but I was also very aware that you get more whatever with honey than, you know. So anyways, but at this point the doctor came in, we're 45 minutes, still no antibiotics on board. And I lost it. And I just said, you pay me. You pay me. We are doing this nursing, we're doing all our own nursing. You pay us, or get us the hell to, you know, our local hospital right now. And she did, and we got to ride in the ambulance, because they said no one could ride in the ambulance, and we got in. And and then we went up there, and that was one of those moments where it was like, you know what? It really felt like an us against them kind of situation, which was too bad. But our relationships weren't established in that, and we gave them every opportunity to meet us. And with having standing orders, with having clinicians who understood the Hickman care and all of that, and they weren't doing their job. And I wasn't going to sit around and have to do the job and also live in fear that something could happen. So sometimes it does pay to be a little out there. And I'm sure that they went home probably and felt like, had an understanding of why that all happened. I don't think that they thought it was some raging lunatic, but maybe they did. And my child was safe when we were at our local at our children's hospital, so it worked out.
You both have obviously been very hands-on. We're very hands-on in terms of care. What was it like for you when you were at home with your child in terms of the medical support that you were receiving or the interaction with the hospital?
We were discharged from the NICU. He was 6 weeks old, and he had just had open heart surgery. He had a little dime-shaped open wound that I was trained to pack wet to dry dressings with gauze and saline 3 or 4 times a day, which didn't seem bad to me, so it was my baby. And he had an NG tube. They had sent us home with this little horrible drip bottle that you hang upside down and adjust the flow by clamp, which I was just, you know, he was constantly throwing it up because I couldn't get it. I didn't know how fast the rate was. It was like from the 1940s or something. It was ridiculous. And so we had home nursing coming once a day in the mornings just to kind of check on the wound care and see how we were doing. And sometimes they were great, and sometimes it was just like the knock on the door would come, and I wished I had like an underground tunnel to flee out of my house. That was just really a mixed bag. That tapered off, and I just felt really comfortable doing the care. I don't get grossed out, luckily. After the liver resection, he came home with a huge open wound, so the little dime-shaped thing I felt like was just training for that. It was much more intensive. He had a G-tube for 4 years, which I did at home. I pumped milk for 2 years for him to get in his tube, breast milk. I just did a lot at home. I really preferred having him at home if it was at all possible, and the medical staff knew that I was competent in doing that and really supported that wish. When we were waiting to start chemo and he got the systemic yeast and he needed everyday amphotericin, which is like a 6-hour infusion once you flush it, and they were like, don't you just want to be inpatient? And I was like, no, I really want to have him at home. I don't know if we're ever going to be back at home permanently, and even if we're just there at the night time, it feels so good to have your baby at home, and it feels good for him to be at home as well, his new brother. And so I did the everyday trek by myself with these two to go do that and come back. And he had PICC lines. They didn't want to do a Hickman for him because of his heart, trying to save those vessels in case he ever did have his last heart repair. So he had long-term PICCs in both arms. And, I learned how to flush those and do the hep block. And I really was trained at home to do a lot of care for him. And it was great having him at home as much as possible.
My guess is it probably would have been greater had you had a competent nurse that felt like was in your house, that knew the vibe of the house and everything that you could just be a mom.
Right.
Yeah.
And that wasn't offered to us, The underground tunnel thing made it so that I would have just rather learned to do it myself than have these annoying intruders, they felt like, in my house. So you're right. It would be great if that home palliative kind of home health staff could be more trained, in pediatrics. I mean, these people barely worked with children. They were, I think, kind of freaked out by this tiny kid with like a gaping hole in him. And I was not, because that was my baby. And so there needs to be just more of that pediatric palliative training done in our community, which is what we're really advocating for.
Mm-hmm. Yeah, I could use up this whole box of tissue telling my story around that, so I'm not going to. But what I'm going to say is that it's imperative that you get the right people into the home. As clinicians, can you imagine? There's rules around why you're not supposed to take care of your own child. There's rules around why you're not supposed to do this with your family. To expect parents and family members to care for their own children the way we've been having to care for our own children at home is outrageous and shouldn't be happening. And so we need to fix that part. We need to let people know right away that that there's support that can be offered with competent people. We didn't know until, I think, six or 7 months into Maddie's treatment that there was in-home support and that there was a care coordinator, a home care coordinator. We didn't know. So she introduced it. Yeah. So really? I know. She introduced herself, and I was like, so what do you do? And we were on the phone making all those calls. We were doing all those things. And when we're doing that, we're not able to be parents. And we think that that's just our job because that's our baby, so that's what we're supposed to be doing because we're good moms. No. There's somebody else that could be doing it. You can get the right people and make sure they're the right people. And have discussions with the families to make sure that they're the right people so they're not digging that tunnel.
You meet a lot of people through the course of this. Did you really have an understanding of the various roles that each of these individuals on your child's medical team, what role they played in your child's care?
We did not at all. To us, it was mostly just the doctors and the nurses. And once he was in oncology, we added nurse practitioner to that. They played a huge role in communicating really effectively. It was a great bridge to the doctors between the nursing staff and the doctors and the family. But as far as all the other parts of the team, like the child life specialist, the chaplains, the social workers. To us, they were all just in our peripheral vision. We had no idea what they could do for us, what their role was, anything about them. And, you know, we had been inpatient for a large part of 4 years. And it was finally during that third heart surgery that one of them came to me, the social worker, and said, you know, I can get you passes to swim at the Rinconada pool. And I was like, oh, really? Because I love to swim, you know. And, you know, I had never known that for the last 4 years, and that would have just been really nice. You know, I didn't know that they even did that kind of thing. To me, it was just another person who came, and, you know, when I saw them coming, I was just like wishing I had that tunnel to flee from the room. And it was another little annoyance. Like, you're not a nurse or a doctor. I really don't want to talk to you and have to relay how I'm feeling right now and how, you know, I have a great support system with my family and my community and my friends, and, you know, you're just bugging me. I don't want to talk to you. But I didn't know that they have services that they actually offer which are valuable. I personally think it would be great, you know, to keep at the bedside or when you check in and you're lying there for 24 hours awake, not having anything to do except try to learn everything you can when you're ready to, a sheet that says the social worker does this, you know, the chaplain does this.
Cast of characters.
Yeah, right. Who are all these people? We have no idea. We've never been in the hospital before. Who is the child life specialist? What do they do? You know, they could have done a lot for us, and we just have no idea.
Right. Yeah, absolutely. I'm in complete agreement. I mean, we had the social worker introduce herself. It didn't make any sense to us. Social worker on the outside means somebody that takes your kid, or, you know what I mean? Somebody, you know, social worker on the inside means something very different. And, or chaplain even. I mean, here we're a lesbian family, chaplain walks in, we just put up the hand. It was like, whoa, but they could have then kind of circumvented that and said, you know what, we have a meditation room. Or we have, I mean, there's ways around. If you can demonstrate your expertise and show us what value you have as clinicians, because I know that, I mean, this story, you've heard this before, right? I mean, the whole, you know, the multidisciplinary team, which is really the nurse and the doctor according to parents, right? So there's a big learning curve for everybody. So why not circumvent it and just say, here's what I can do for you, and here's what I can do for your family. Not, I want to help you. We don't want, like, how, like, it's so nebulous. Show us ways that you can help us. You know, give us those vouchers. Make those calls. Connect us with local organizations. You know, all that stuff. Make it practical, and then we'll listen. But until it's practical, we want who's going to save our child, you know?
We have a lot of student nurses here today, and one of the questions that I got was, what would you like them to know now before as they're about to step out on their careers about talking with parents about grief, or in Tara's case, anticipatory grief?
I think just bringing in also your life experience. I mean, you've dealt so much with all the medical piece right now, but there's also that whole level of life experience that you can bring in and draw from. And I think really dealing with your own fear around it, journaling, you know, whatever it is for you, dancing, you know, naked, I don't know. But just dealing with your own fears about not dealing with parents, but communicating with parents. Because that's really what it is. It's about meeting people, right? And where they are, and understanding and having an idea about what their struggles may be. And then maybe as you develop a relationship, you can actually have a conversation around that. But making yourself available to that, you know, instead of coming into and just doing your job, which is to hang this or deliver this and get out, you know, because we feel that. Mm-hmm. We're sitting in there, we feel it when people walk in and they're feeling confident in their own skin and they can do their job effectively. So I think just drawing on what you have already, that you have lots of experience that maybe you don't even realize, and so much of it is making yourself available and being available to people. So I would say that's a big part of the job, and the rest is going to come. So
I agree completely. I think that just making families feel like you're comfortable when you walk in a room, instead of just going straight to your job and doing it and leaving, if you can walk in and just even say hi. Maybe that's the only time we're going to talk to any other adult that day other than our partner or the doctor, you know? Just, you know, you don't have to do much. Just say hi. If we're feeling like we want to talk, we probably will. If we don't want to, we definitely won't. Just communication is key, being open to communication, and just realizing that parent who's in the hospital with a sick child is constantly grieving, because nobody wants to be in that position, you know? It doesn't have to be when it's at the, you know, 11th hour. We're constantly wishing we were not doing what we're doing. So just being aware of that and giving us space to talk if we want to, and giving yourself the space to have that capacity, which is hard, I'm sure. I can imagine, but it makes a big difference to us.
Mm-hmm. In your own personal experience, or in your experience talking with other parents, is it okay for a clinical staff to share their own personal beliefs, specifically actually in regards to when someone dies?
I think it depends on the level of relationship you have with the family already. I think if that's already established and you know that I'm Catholic, or I'm, you know, Buddhist, or I'm whatever, and if you're of the same, or you feel like we can meet someplace in, you know, in that arena, then yeah, maybe doing that. And if not, asking what my faith is, or spirituality, or something like that. I wouldn't assume and then say something like that, because that actually is offensive. So that would be offensive to me if someone came in and said, you know, oh, well, your daughter's going to the angels. It's like, screw you, she should be here with me. I don't want her with the angels. I haven't even seen an angel before. So, I mean, it could escalate things, or leave a mark that really doesn't rub away over the years. So I would never assume. So that, again, comes with communication. And but so much of it, too, is just having the ability to sit in the uncomfortableness and sit with the sadness, and not insinuate yourself necessarily into the situation, and want to make it kind of about you. And also there's that, the other piece is trying to make it all about the parents, because then again, you're not meeting, right? So it's like, if you're just like, oh, it's, you know, if you kind of do this kind of thing, then as a parent, you're kind of feeling like you're an alien, you know? But if you can kind of come together a little bit around it, and if you're sad, you can say you're sad. And if you feel hopeful, or if you feel, you know, whatever, I mean, there are ways of doing it, but so much of it is being able to have so much of it is courage, really. I honestly think that it is. And having the ability to just not run out of the room. Yeah.
What kind of comfort words we would like to hear from us, like caregivers? Because sometimes we don't know what to say, you know, and whether it's offensive or helpful to you. So what kind of words that are comforting to you would you like to hear from the caregivers?
You know what? So much of, 90% of all communication, or 80%, is body language. So much of it is just being able to be there, taking a hand if you feel like that's your level of relationship, that you take a hand, or that you come to the bedside and linger a little bit, you know, or you say, I care for your child so much, you know, something like that. I'm sorry, you know, yeah, we're all sorry. This is all pretty awful. It doesn't really do anything, but something about, you know, she's such a gift, or he's such a gift, or something like that. I think that's really helpful. Yeah, but the I'm sorry, or what are some of the other ones?
Yeah.
She's in a better place. Oh! Yeah, don't say that.
She's not suffering anymore.
Yeah, not suffering anymore.
Suffering, better place.
Yeah.
God wants him more than you do, or
Yeah,
you know, all that kind of stuff is not necessarily going to fly
Yeah.
to everyone. So I would really refrain from doing specific things like, you know, he's flying up to heaven now, or you know, we had a lot of things thrown at us, and we're not particularly religious at all. We're, you know, have our own belief system, which doesn't involve necessarily that, you know, God needs him more than we do, or gonna go to heaven, don't worry, he'll always be with someone, you know, like that stuff just didn't help. It was very offensive.
But it could help if you were
help.
if you were Catholic
Exactly.
or you were, you
So
know, and you had said that, then
Right.
man, you're really meeting that family with where they need to be.
So
you
I
know?
think that, like you said, if you have a developed relationship with a family and you know them, that's great. Also, intake forms, instead of just saying religious preference, could even be a little more specific. That, you know, religious preference, and here's what I might want to hear. You know, here's something I definitely don't want. And just a little bit more information about the family, even if you don't have a good developed relationship, because you see so many people. As far as communicating, I think that just silence is a huge thing.
Yeah.
Which is not, you don't always have to say something. Like being in the room where it's uncomfortable and obviously we're a wreck and our child is extremely ill, maybe gonna die. Don't feel like you have to say something. Just being there with us really does make a big difference. And knowing that you're comfortable enough to share that space with us if you can and if we want you there. There aren't really words that are needed. Sometimes just being quiet might even prompt us to start a conversation, and you would know more what we want to talk about.
And there's no right thing to say. There really isn't.
No.
So, but yeah.
If you were to have been asked, you know, what are the two most important things that you value? What are the two most important things that you want from us as clinicians? Would that help, you know, whether it was, you know, I don't want my child to have any pain, or I don't want to be, you know, spoken to about religious practices, or I don't know, just the two things that were the most important for you that we could look at all the time. Would that be helpful?
Yeah, I think actually asking more, you know, it's so hard because to kind of get in the psyche of every parent. And so I see that, you know, most important
Changes too, I think.
it does change over time.
Yeah.
It does change over time. So
Day to day.
I think just being available and willing to hear what we're thinking. Ooh, that's another thing. So instead of saying, I'm here to help, or do you want to share, do you want to talk, you know, that kind of thing is really hard for parents because we're just barely putting one foot forward, and to actually kind of go at that level of relationships really hard. It's like, I'm fine. I'm convincing myself I'm fine right now. And so to then bring it down and talk with you, that's really hard. But if I can, if you can ask me what I'm thinking about, I've got lots of thoughts. I've got lots of thoughts about my child's care. I got lots of thoughts about how I'd like to have things be different, or you're going to get a lot more information from parents if you ask them what they're thinking rather than how they're feeling. I think asking how a parent's feeling is really scary for a parent to answer.
I agree.
How has this affected your relationships with your spouse, with your family, with your children, with your friends?
Well, we had a huge support system. I mean, people did fundraisers for our family. Our community really pulled together, and we really felt that blanket of love and support, which I personally think, because medically there's no reason he's still here, is what really helped us get through and helped him get through. Just that power of, you know, group positivity. But relationships are really hard, especially when you're going through it so ongoing as, you know, I still am. My marriage ended. I was married for 10 years, and, you know, my husband just couldn't handle this, and we kind of went opposite directions. I wanted to learn everything, and he was like, how can you want to learn about that? It's so horrible. You know, but it was just life, you know. It still happens. Theo had pneumonia last week, which he gets once a week, and he tried to tell me that it was because he ate sugar over the weekend. I was like, actually, he has, you know, tumor scars in his lungs and half of his heart, and gets this once a month. There are different levels of what we can deal with, and you know, how much in denial we are, and that's really hard, just to be able to meet somewhere over an extended period of time. It is doable, as Lisa shows, but it is really hard. That's why there's such a huge divorce rate in chronically ill children's families, or, you know, if you lose a child, it's really hard to stay together. Friendships, I still have a strong core group of friends who really rose to the occasion. Some friends really couldn't handle it. It was too sad for them. I have a friend who came and visited in the PICU once, and she could just last in there for like 3 minutes. And she was honest, and she got up and she said, I just can't do it. It's too sad here. And waited, and we went out to dinner later, and I appreciated that she communicated that. I'm still friends with her. She's one of my dearest friends still. She couldn't handle being in there. It brought up too much for her. And I don't think that's wrong. I appreciate that she could tell me that. People who just like fell off the face of the earth, I'm not friends with anymore. Because, you know, it's all just comes back to communicating, really, and meeting people where they are as best you can.
Yeah, I would say that our friendships and every relationship has been affected by the loss of our child, and even the new ones. After we lost Maddie, it was like we didn't want to be friends with anybody that didn't know Madison. So for 3 or 4 years, that was great, except for then we had another child, and then we have play dates and things like that, and it was like, ugh, you know, because we had a big community, and so we didn't have to worry about that. Everybody knew our story, we felt comfortable in it, and our friends still, to this day, bring cards and presents and celebrate with us on Maddie's birthday and grieve with us on Maddie's anniversary, and it's been 12 years. So every year, twice a year, Madison's recognized. They share her stories, you know, all of that. But I would say that Nancy and I are together because Maddie died. And if we got divorced tomorrow, it would be because Maddie died. So we are completely affected by it, and every single day. And our children still, even though they didn't know her in their heart. And I have all kinds of crazy conversations, and I think, wow, this is because they had a sister who had a serious illness, and she died, and they're maintaining their relationship. And in some way, I'm still parenting Maddie from doing these kinds of things. And so part of it's because I could never say thank you enough to the clinicians, and I never said it out loud that often, but that's why I'm doing this advocacy work. And also because this is my way of parenting my child. And I don't know that many parents would tell you that, but I think that might be something that's true for them. My youngest, Hayden, who's Tara's his piano teacher, and Hayden, thank goodness, he was our third child, and he came out looking just like his sister. I mean, an exact replica. It was frightening. And so I was really glad that we had Delaney, who was blonde hair and blue-eyed and wasn't zen at all. She was just angry, you know, as soon as she came out, you know, and I was like, oh, they're so different, thank God, you know. So it was a lot better to parent her because I didn't feel like they were so much alike. But I didn't take a breath until after she was 2.5 years old, because that's when Maddie died. So I didn't think she was safe until after she got over that hump. And the same for Hayden. But Hayden wants to know all about Maddie, all about the physical parts of Maddie. Not so much who she was as a person, but how she died, was she buried, did we burn up all her bones, I mean, you know, he's a 6-year-old boy, so he wants to know all these details, really explicit details. And so, you know, we share those with him because that's what he's asking for. With Delaney, she doesn't want to know any of that. She wants to share her sadness around her sister and wants to share that either she dreamt about her or that she wishes she had a sister and not a brother. She uses, you know, when Hayden's on her nerves, she's like, I wish I had Maddie instead of you, you know. And so she brings her back from the grave to haunt her brother. And, you know, I mean, our lives are so, she's still so much a part of our lives in every way. So I would say that any and all relationships are completely affected by the illness and the loss. It was very difficult for us to bring. I had to bring in a friend to come with me anytime the kids were sick. If Nancy was working, which was almost all the time, I would call my friend because I'd start to have a panic attack going back into a hospital setting or into an office setting. It was very scary for many years, and it's just been in the last 4 years or so that I can go in and feel good and not be like candy or, you know, trying to medicate myself with food. So we're always affected, and so it would be good to know on your little ledgers what kind of experience people have had. Is it their first child that's been ill? Is it their second? I mean, it really affects every part of who you are as a parent.
Right, like we'll go in for blood draws and they'll say, have you ever had a blood draw before? And he's like, you know, I want Coban, I know where the pencils are. And then once they look at his arms, they're just like, oh God, I'm sorry I asked that. You know, but just, it's true, you know. We've been through a lot and it would be good for people to kind of know that. Also, what you were saying really reminded me of, we were at the grocery store last week and Theo had this horrible cough because he was getting over his pneumonia. And the checkout lady's like, oh, he has a really bad cough. And I was like, yeah, you know, he has kind of coughs all winter. He has some medical issues or something. I forget what I said. Something just so people look at him like he's contaminating everywhere with swine flu or something, which is not
Right.
like he's just disgusting. And Tommy says, it's because he had the cancer. And you know, Tommy was like a newborn when he was, and everybody just looked at us like, oh my God, this poor lady. And I was like, please just pack up my groceries. Let me get out of here. But it's really present in their minds. Yeah. He's 6 also. And you know, they think about it all the time in ways that we don't even realize.
Mm-hmm. And even when you're kind of, I mean, it was so much easier to come out as a lesbian than it was as a bereaved parent. So much easier. And but when you have a 3-year-old that's running to the park, my daughter Delaney's running out of the park, and I've got, you know, Hayden in my arms, and she's like, my sister died, you know, and I'm like, oh, you know, I guess we're not going to be picnicking with them. And then she's like, and I have 2 moms, you know, and I'm like, oh my God. And so I've just had to just kind of, you know, it's her life too, and you just got to roll with it. But yeah, it's a lot. It's a lot.
There's a question here about how do you get up in the morning, and what are ways in which we as clinicians, healthcare providers, can help parents. I think we've talked a lot about communication, but I think we're really addressing in this question some of the practical things to do to kind of help lift parents up when they're going through this experience.
Well, what I have always learned and believe wholeheartedly is that just being in the moment is how do I get up in the morning. I don't ever think about what I have to do or what I have already done. I really try to take it not even a day at a time, but one moment at a time. There were times when I would be driving over the hill and I'd have to stop, you know, on the side of 17 and nurse Tommy and catch vomit in a Tupperware in the other hand. And you know, that can seem really overwhelming if when I'm getting in the car I think, oh my God, I'm probably going to have to stop halfway and catch vomit and nurse. But when you're in it and you're just doing it, you just do it. And I really live that way because I would lose my mind probably if I didn't live that way. And I'm glad to have been raised that way and really had it cemented with my experiences with Theo to try to appreciate each moment I have with him. I remember the first time he got chemo, he was the child life specialist. I had kind of learned by then a little bit what they do. They brought him Mr. Potato Head, and I was sitting on his bed with him playing Mr. Potato Head, and it was his first chemo. I was going in. They had come in with like the mask and the goggles and the, you know, drapes and the gloves, and I was like, oh my God, what is going on? I was, you know, hugely pregnant. And Theo was just so happy, and I kept waiting for him to start feeling bad or his hair to start falling out. I didn't know what to expect. And he was just laughing and playing, and my husband was sitting on the bed, you know, the parent bed, just weeping, not present at all, and which is what he needed to do at the time. And I just chose to, because at this point we had been given the death sentence, maybe this is Theo's last 5 minutes, and he's so happy playing Potato Head here. I'm just going to be with him and play Potato Head. And so that was a really striking moment for me to kind of shift my way of thinking. As far as what you can do, concrete, practical examples, I have a hard time with that because I think every moment is so different, what we're feeling or going through or wanting. We don't even know. So I don't know that I can give a blanket answer to that.
Well, I think also, you know, not just having the nurse or the doctor, that if you knew what the social worker or the chaplain or the, you know, like
thanks to the child life specialist, I had that pivotal moment in my reality, you know.
Right, so that's helpful.
Yeah.
I know for me, it changed over time. I think if we would have gotten bereavement support that was by people that actually knew what they were doing, we initially had an intern do a bereavement group, and that was just a nightmare, and I actually ended up going away from it feeling worse than better. And we stuck with it for almost 7 months after Maddie died. But that was really hard. And so I think there needs to be a lot more research about bereavement, because as a parent, you're just struggling to find out, you're just struggling to survive and wishing you were dying the whole time. And waking up and thinking, I can't believe I woke up again, and really waking up half dead and walking through your life and observing your life happen, and for many, many, many months. And it wasn't until, alcohol was really great for me. Food worked really well. But antidepressants, trying everything to just get out of that feeling of loss, because I felt like it was just going to consume me. Once we went ahead and got pregnant again, which was a very conscious choice, obviously, I decided that I wasn't going to, that I had to get up and get dressed in the morning, that I wasn't going to let grief spill over into my everyday life. So of course I waited until Delaney fell asleep on her walks, and we'd walk, and that's when I would cry. That's when I would, and lots of friends, Tara and I wrote an article for Hope Magazine, and you can hear a little bit about our story, read a bit about our story in there, and one of my best girlfriends really carried me in her heart for, she still is really, but for about 6 years, 2 kids later, and she kind of held that emotional grief piece. I felt very safe with her, and I wish that it could have been spread out a little bit more, because when she left, and even she missed Madison's last anniversary, I still get panicked around it. I still don't think I can survive it. I don't know why, 12 years later. So there's, it's nothing. I think just having bereavement supportive services, checking in with parents, and not abandoning them. I hear a lot about abandonment afterwards. I think it's because there's not a lot of follow-up, perhaps, or the follow-up happens 3 months later and you're still, going out every night and getting drunk, or laying home watching TV the whole time. Nancy and I had completely different reactions to grief. She was, she would just turn on the TV and watch station after station. She had like carpal tunnel, because of doing the remote control. And I would take off at 8 o'clock. I thought, I can't be here. I can't be in the house. And it was because I used to nurse Madison to sleep at 8 o'clock every night. And so during that time, I was like in the car, driving 100 miles an hour down the road and singing, screaming. And that's how I was dealing with my grief early on. So it'd be really helpful to have like a follow-up 3 months, 6 months, a year and a half. Maybe even engaging parents to come in and serve on something. If you felt like they were really great advocates for their children, maybe you could ask them to participate in a panel situation or a committee work or something that they might do well with. So there's lots of different ways. I think there's just good ideas. Go with it. If you have an idea, take it up with your administration, ask another parent, and make it happen. This is all such a newly emerging field. I think it's anyone's guess a lot. There's not a ton of research, and so I think you need to follow your heart and find different things and develop your own programs that are going to support parents.
Lisa, this question is really more for you. At what point did you know Maddie was going to die?
Never. Never. Her last breath. Never. Never could imagine it. I could never imagine. I never knew she was going to die, ever. So even when we got the 6-month prognosis, even when her breathing changed, even when we were in bed with her and she was gasping for air, and I still kept on holding out hope that it was going to shift. Something was going to change, because I couldn't possibly imagine. Kept on thinking that God was going to take me instead, and we'd be able to switch places. That whole magical thinking thing, that's real, and it lasts for a very long time. So no, I never knew that she was going to die. But I heard she was, and I did everything else to stop that from happening. But as far as knowing it, and so I've been working with lots of different hospice workers, and they're very concerned that the parents don't know that their children are going to die. And they feel like it's their job, because doctors haven't done their job by telling them that their children are going to die, that they really want the parents to know. And so what I'm saying is that you can give all the information you want to, and please do it. It's your moral and ethical responsibility to tell us what our children's prognoses are, because that's going to make sure that we get all the people around that we need to see our child, that we do all the things that we need to do for our child, so that we can look back and know that we did everything possible. But as far as that one glimmering moment when we say, oh, thank you so much, I didn't know my child was going to die, that's not going to happen probably. And that there's, in the background of our mind, it's a possibility, but it's not a probability. How can we still, put one foot in front of the other every day and be in the moment and be the best parents possible when we think our children are going to die? I think it's something primal in there. I think it's never going to happen. But I'm just one parent. That's just my experience.
Tara, Theo is living with this. You're living with this now. And you know that you're faced with more surgeries down the way.
Right.
How do you move forward with that knowledge? And how does that impact your daily life beyond just the medical issues?
Like I said, I really try not to think too far ahead. We go to cardiology every 6 months. He gets echo and EKG, and they had all been pretty stable. About a year and a half, I guess almost 2 years now, he started to kind of deteriorate a little bit, heart function. They haven't been doing these surgeries for, I guess, 25 years or something. They've been doing them. So we don't really know long term or when he's going to need, what he's going to need. So far, his heart has done remarkably well. The right side isn't supposed to do what it's doing. They've kind of rerouted his circulation. So in essence, the right side is the left side, and his body is the pump to his lungs. It's kind of an amazing concept. But, the right side is the smaller side, and it's not going to hold out forever. And I'm realistic about that. I know that he is going to need something else. Every time I go to that 6-month appointment, of course, I'm just waiting to see, is this the time that they're going to tell me he needs something? It hasn't happened yet. It will happen. But in my daily life, I really don't think about it unless it's happening in the moment. Like this morning, he's had pneumonia for a few days, and he's over it now, but he still has the cough, and he slept in till 9 o'clock. I took him to school late, and I just let him do that if he needed to. But he woke up super puffy around his eyes, and I was like, oh, let's give you your Lasix, because it really does make a big difference. So I'm always kind of on the lookout, I would say more peripherally, for signs. Is he not eating enough? Is he looking puffy? Is he more cyanotic? I have an O2 monitor at home, but I try not to use it because I can really tell by looking. But I don't think about that stuff all the time. I really don't. I try to just enjoy watching him play with his brother, or, going to his little school performances and hearing him sing. He's going to start a dance class. I just try to, enjoy the moments. I don't think long term, because it will make you go nuts.
So I guess the question I would ask for you now, just to kind of wrap up, is what would you like for people as they're walking out the door? What's the one thing you would like people to walk away with from part of this conversation?
I guess I just want to say thanks for your courage. You guys are going into an incredible field, and a lot of you have been in it already. And I know it's not an easy one, but I also know that's a really rewarding one as well. And just thank you. That's all.
I would agree. Just, thanks for being there for us and for our children. It makes a huge difference. And every little bit that you do means more to us than you know, probably. So thanks for coming today, too.
Thank you.